Am I in labor? Is my labor starting? Is the question that I get the most from you mamas. In this video we're gonna talk about sure signs of labor and when it is best to go to the hospital. Welcome mama, this is part 2 of a 3-video series where I try to give you the skills necessary to let you understand when it is a good reason to go to the hospital, when it's not, and what's happening to your body in general in this crazy pregnancy. This video is dedicated to you if you are having a term pregnancy, meaning above 37 weeks, and you know that your baby is cephalic and overall you have had a low-risk pregnancy with no complication or minimal complications, and you are allowed to stay home for the early part of labor. Again, disclaimer that I have to make, I'm not telling you that you can stay home. If you're not sure, if you just feel something in your gut, then just trust your instincts and go to the hospital. It is very hard to understand if you're going into labor or not. There is no perfect formula, there is no right definition, but I'm gonna give you some general rules that might help you to understand if it is a good time for you to go or if you can wait a little bit longer. Why we want to keep you home? We want to try to avoid as much interventions as possible, especially when you don't need them. We want you to be able to stay at home in your own environment where that kind of production of hormonal cocktail is enhanced. You have your own bathroom, you have your own kitchen, you can have quick access to drink, food, shower, birth partner. It's so much better to stay home. That's why we don't want to be mean when you call or you go to the hospital and we might send you home. We're actually trying to protect you and to keep you away from the hospital as much as we can. Don't get me wrong, the hospital is not a bad place where you're gonna go, you're gonna receive interventions, but we have evidence says that the minute you step in the hospital, the famous cascade of interventions is gonna start. So just stay at home if you are confident and competent that you can spend a little bit of your early labor at home. We can certainly say that you are in labor when you are experiencing regular contractions for the past 1 to 2 hours and your cervix is changing. At least we want it to be 4 centimeters. Now, check again my video when I talk about examinations and dilatation and all these facts related to what's happening to your cervix. You are gonna find so many different definitions about centimeters and when it is actually the beginning of the active labor or not. Some guidelines, they consider it to be 3 centimeters, other 4. The American College even says 6. Also the WHO, if I'm not wrong now, brings the active labor start at 6 centimeters. It is very subjective and it is also related to the operator that is doing the exam, so you can understand that it's quite hard to define the start of labor simply with a vaginal examination. So you might ask me, then how can I do to understand if I'm going into labor or not? General rule, you want the contractions to be regular, frequent and long. The closer, the longer, the frequent they get, the better we like. There are so many rules that you can follow. The most general one, if it is your first baby, is the 3-1-1, meaning contractions every 3 minutes that are 1 minute long and they last at least an hour. I will probably prolong the 1 hour to 2 hours. You kind of want to have, my general definition, what I usually use is that you want contractions to be 2 to 5 minutes apart, at least 1 minute long for good 2 hours, because you're never gonna find a woman that has perfect 3 minutes on the clock contractions, but some of them might be every 2 minutes, other every 4. What you don't want them to be is to be 15 or 20 minutes apart. You definitely want them to be closer and you want them to be that close for at least 1 or 2 hours. If you have history of precipitous labors, meaning the baby comes extremely quick, or if it is not your first baby, then you might want to observe a different type of rule when they're kind of every 5 minutes and they last a minute for at least an hour. Then you might start to pack your things and go to the hospital, just because 2nd, 3rd, 4th babies definitely come quicker. And again, it depends how far you are from the hospital. If you are 15 minutes, then you are good to wait a little bit more. But if it takes you 30-40 minutes, then you do want to make your way in if this is not your first baby. You can time contractions, you can get your partner to time them, or you can use, like, there are so many apps now, they're very cute, that they help you to understand the pattern of these contractions. You have to time them and to count them from the start of one contraction to the start of the other. The time length that you have between these two contractions, then it is the interval that the midwife is going to ask you about when you come to the hospital or when you give a call. Contraction, as I said, can be very regular and coordinated and starting to have a very recognizable pattern. But if you're coping okay, then it's fine. You can definitely hang around. If your baby's moving and you feel okay and you're coping, it's alright. Some women have just a different pain threshold, or some uterus just work better and more efficiently in order to have those regular, perfect contractions, but maybe they're still not quite the ones that are gonna dilate you. If you are able to do your own business, if you're able to talk through them, it doesn't matter how much regular they are, they're just not the right ones. Even if you feel them and you're gonna be like, oh, that was a contraction, that's not a labor contraction. And if it happens again after 2 minutes and you're still like, oh, that was only 2 minutes, cool, probably I'm going into labor. You're not. You want to be kind of like, I can't talk to anybody right now, or like those kind of contractions. Then they might be more reliable, they might be more the ones that we need for your cervix to make changes. There are also mamas that are absolutely in their zones when they have contractions, especially those mamas that are using hypnobirthing, or even mamas that they just have a awesome control of their breathing and they just breathe through the contractions. They're not even in labor, they don't even look to be in labor from outside, and then suddenly they just have the baby. They do something like this. Baby's coming, and you'll barely have time to put gloves on. So just be flexible and understand that you might be one of those lucky women, or you might be one of those that just cannot help herself but scream and vocalize when you have a contraction. That's fine as well, and you're gonna be one of those that does like whatever helps you to cope with them. It's fine. We don't judge the labor just from how loud you are, so don't worry for that. It's totally up to you how you decide to react to labor and to the contractions. This is why you also have to educate your birth partner so he or she can understand what's happening to you. He also might think that you're gonna be extremely quiet and then you are totally the opposite, or vice versa. You're never gonna know. And even if it's not your first baby and your first baby has been in a certain way, it doesn't mean your second labor is gonna be exactly the same way. Another reason to go to the hospital is if your water breaks. I did a full video on the water breaking topic because I believe it deserves a bit more attention, and so make sure you check that one out as well. When your water breaks and you're having contractions, then it is a definitely sign of labor because something is happening. If your water breaks but you're not having contractions, then I explain you in that video why you can wait a little bit longer to go to the hospital. However, you do still need to call the hospital, and according to what they do, they might ask you to come in anyway, get checked, and then send you home. It depends really what their policy is in that hospital. But generally speaking, when your water breaks, you do want to go to the hospital, or at least first make a call and ask about what their management is going to be with you. Although the contractions are irregular and your water hasn't broken, if you experience this symptom, then you might want to go to the hospital anyway. And I'm talking about if you feel the urge to push, if you feel pressure in your back passage. You're gonna feel pressure in labor. I'm talking about like unbearable feeling to push. Then you definitely want to make your way in quite quickly, especially if it's not your first baby. Last but not least, although you don't meet any of these criteria and you're thinking, oh my god, what am I gonna do? If you're not coping, then that's always a good reason to go to the hospital. We definitely don't want you to be at home struggling if you're not able to stay at home, and that's absolutely fine. It comes down to be prepared and to be educated, but you might be as much educated and prepared as you think you are. Pain threshold is so varied among women that you might not be able to cope, and that's okay. You want to go to the hospital, we can give you some pain relief options, or you might just need a piece of advice or a piece of reassurance. Please don't stay at home suffering. if you can't cope with labor anymore. It doesn't matter if it is early labor, doesn't matter if it's active labor. If you're not coping, it is always a good reason to go to the hospital. It might also happen that you meet all these criteria that I told you. Your water has gone, you're having so much regular contractions for the past 1 or 2 hours, and then the minute you come to the hospital, everything stops. It is actually quite common. It is the cocktail of hormones that it was produced in your home environment that suddenly stops when adrenaline is produced in the hospital, when it is a new environment, when you don't know the people around you, and your body kind of goes into the fight mode. So it might be common. If it is false labor, they won't come back, and it is actually a confirmation to you that you get that it was not the true start of labor. If it is the true labor, don't worry. Once you settle back in the mood where you're gonna be nice and comfortable, then those contractions are gonna come back. So don't get disappointed if when you go to the hospital everything stops. And I get women so frustrated that they look at me begging me to believe them, saying that I really had them, I swear. They show me the app, they show me the recording that I make about the contractions, and I do believe you. It's alright, don't worry. No one is gonna blame you for coming to the hospital and then the contractions stop. It's alright. We're always there to help you and to make sure that you and your baby are fine. I do get you that it is quite hard to understand and you might be overwhelmed by all this information that I gave you. Just feel free to watch the video again, and generally speaking, if you think that you're in labor and you've been able to watch this video entirely, probably you're not. I'll see you in part 3.